that we're ready to start live streaming. Okay, we're good. All right. Well, welcome everyone. Thank you for joining us for this week's Faculty Friday. We're excited about this one. We know there are a lot of questions about testing and assessment because we're doing things quite differently with everything here at Noorda-COM. And so we're happy to have Dr. Akunyili and Dr. Manley join us to talk all about testing and assessment today. Just as a reminder, if you are on Facebook or YouTube, you can drop your questions in the chat. We are monitoring those. And then if you're joining us here on Zoom, please use the Q&A feature and we will have time for questions and answers at the end. So feel free to drop those questions in just as they come up, and then we'll make sure we have time to answer those before we wrap up today. Without further ado, I'm going to send the time over to Dr. Akunyili and Dr. Manley.
Thank you very much.
Kristen.
Dr. Akunyili,
I'm Dr. Akunyili. I'm the Assistant Dean for Academic Affairs, and I'm here with our very esteemed Dr. Manley, who I'm so excited to be working with, who's our Assistant Dean for Assessments at Noorda-COM, and we're very glad to be talking to you guys today about everything assessment. So I was going to just ask Dr. Manley quite a couple of questions so that she could just lay out a little bit of the vision of what we're trying to do at Noorda. I'm going to let Dr. Manley introduce herself first.
Okay, there you go. My name is Leslie Manley, and I'm the Assistant Dean of Assessment. I live and dream in multiple choice questions. I have been doing this for so long. I've been in medical education, specifically boards prep for medical schools, dealing with step 1 and level 1 primarily. Also some step 2 and level 2 as well, but for over the last 20 years. And before that, I worked at a medical school where I was also involved in assessment. So it seems like my lot in life is to deal with assessment. So I'm very happy to leave a kind of the test prep arena and bring it here to Noorda.
And actually, Dr. Manley, I have to say, is even selling herself short because she basically almost single-handedly, well, she might have had a little bit of help, but is responsible for the birth of the Q-Bank industry in the medical education space. So the very first Q-Bank that was ever created at Kaplan Medical was full of Dr. Manley's prints on it. In fact, her and her late husband at the time co-founded the production of that entire series and has been responsible for Q-Banks in the test prep space for over 25 years. So when I say we are so lucky at Noorda to have someone of her caliber, as a dean of our assessments, I could not tell you what that really means in practice, but I could tell you we're on our way to having question qualities at the day-to-day level for our students that rivals anything out there. And I'm just so proud of that fact. I can't tell you how happy that just makes me, and how excited that then is for what we get to do on the academics end because of the quality of the assessments that I have in there. So having said that, there are also these things called pod plays that we have at Noorda. Dr. Manley, do you want to talk a little bit about that?
Sure. So we have different levels of questions here at Noorda. So we have what you might want to call formative questions, and then also, the high stakes exams. But one thing that we are interested in is I don't see assessment as like an anxiety provoking thing. It's not a way to make you, anxious and fearful and things like that. Studies have shown that one of the best ways to help you remember is to assess yourself. Because it's a way of active learning. And so a lot of our stuff is on kind of low stakes assessment. And so what I mean, so some of the low stakes assessment we have, for example, is in pod play. So after videos and the like, we will do a little check. Like, do you understand this? Do you not understand this? And it may not be a multiple choice question. It may be, an activity. And Dr. Akunyili, because you've been more involved in the pod play end of things, and I'm more involved in more of the multiple choice stuff, maybe you can help describe some types of the pod play that we have.
Yeah, I think part of it was we were thinking about, well, what can we do to make the process of learning a little bit fun and entertaining and just break it up a little bit? And so part of it too is you have to know information and build up to being able to really answer board style questions. And so sometimes it might just be, something that we're creating in a little sort of gamified way that allows you to test, do you know this concept? Can you click on the right things? Can you drag and drop things in the right place? And so it's still helpful for you to be able to do that. And then still, work up to the board style question, from that particular topic. So a lot of activities and interactivity designed to get you, instead of sitting in a lecture hall for 3 or 4 hours at a time, just listening to someone talk to you, you're getting the information in smaller chunks, but then you're also getting the opportunity at every step of the way in those chunks. So you watch a 5-minute video and then you're doing an activity, right? Whether that is a board style multiple choice question, or whether that is a drag and drop exercise, or whether that's any of the forms of, sort of gamification that we have embedded into the curriculum. It's really just to help you make sure that, okay, you know enough of this piece of information that you could move on to the next video. And again, it's formative. I could tell you from my own personal experience, when I was in medical school, I learned a lot more from the questions that I got wrong than I ever did from the questions that I got right. Because partly when you get a question wrong, it means there's something you missed. You didn't realize how important it was, or you just didn't understand something that you might have thought you did, right? When you get that question wrong, you go in to dig into the reasons why you're wrong. And all of a sudden, you now have this pathway in your brain, if you will, that's solidified, right? So not only have you listened to the information, maybe had a discussion about it, but now that you've gotten a question wrong, you get to go back and really dig into, well, what was my misunderstanding and what are the pieces of information I need to know to get this sort of question right in the future? And it actually builds on itself, because when you get a question wrong and you make a certain type of cognitive error thinking about the topic, you're less likely to make that error in the future. And actually, that's a really nice segue, Dr. Manley, for you to talk about the fact, and I have to tell you guys this, I absolutely love more than anything else the level of detail that Dr. Manley puts into the explanations that are provided. And sometimes not even for the pod play, because the pod play, it's next to a video. You could just go back and rewatch the video. But for some of the quizzes, and the daily quizzes that we're giving students the opportunity to kind of assess where they are at the end of the day, the explanations are so valuable that I've been even hearing a lot of our current students saying how they're using that as a study tool, and I'm like, well, great, that's what we intended them to be for. So Dr. Manley, do you want to talk about that and how that's important?
Absolutely. So again, because I'm coming from kind of the test prep industry, I'm bringing some of this here to Noorda. And one of the things that students have wanted over the years and in this realm is to have explanations. And so what we're doing is we're providing explanations for the correct answer, but we're also providing explanations for all the incorrect answers, because you want to know, why is that wrong, not just why is something right. And so this was something that was impressed upon us as a business, that we needed to have this in. And so this is like the default of what we're doing here. And so I would be willing to bet that there's probably no other medical school. I wouldn't be surprised if we're literally the only medical school that provides that level of explanations with our questions. And so here's how daily quizzes work. So at first, what we'll do is every question has been tagged to specifically what video that you guys are watching and things like that. And so after you've done those videos, then we know it's okay to release certain questions. And so what we'll do is we provide it on an ExamSoft platform so that we can get the analytics from that. But again, not to worry about that. We have daily things, we're trying to get the analytics. It's for our benefit, for your benefit. And this is why. So we get the analytics from there and to try to figure out where your strengths and weaknesses are. And so then that informs our faculty what they want to focus on in the review sessions. So there's always a certain limited period of time, every time is finite. And so we want to specifically target areas that students are having more trouble with, and we can get this information from this data. So, but also you have a chance to kind of see these questions again. So these same questions are going to be in Canvas later. And this is worth a certain percentage of your grade, but you can redo these questions until you get 100%. And the whole idea of it is that we want you to learn. And sometimes learning is through repetition. And and also that is in the Canvas arena, that's where we provide the explanation so that you can really, really delve into why things are right and why things are wrong. And you can do it individually or you can do it with your group and discuss it. So that is, we want to get a lot of mileage out of it and have it be not a stressful type of situation for the students.
Yeah, and some of the feedback I've been hearing from some of the pods right now, the way the students are using it is that way, right? So they're doing the daily quiz on their own to sort of test their own knowledge, and then they're coming back together with their pod and then going through the questions and the explanations and talking things through, and then that then solidifies that concept for you, you know. And you know, it's called a daily quiz, but you know, you have the whole week really to do it,
right.
and so you don't necessarily have to do it, you know, on a daily basis, and you might not even have, you know, a daily quiz every single day. I mean, it's most days, but one of the things I have to point out is the fact that this really is the engine, the data engine that's driving a lot of our, you know, educational model. Because what really happens on the back end of that is we're able to look and see, oh, wow, you know, we thought that the way this particular video was made or the way this particular content was thought was great, but maybe it's not hitting the sweet spot that we need it to, or at least it's not hitting where, because we're also looking at, you know, what percentage of the class is getting this correct and who's struggling, right? And so when a lot more students are struggling than not, then that becomes a, hey, we have to review this content during the reviews, and the faculty then go into those review sessions sort of knowing the concepts that they have to rethink how they're going to make sure that they get the point across to you. But then on the flip side of that, you know, that's also helping us, you know, improve the next year's material and content, right? So some of those things the faculty now have different ideas for how to do. So you, as you know, the next incoming class, for example, would have that advantage of, well, now your content is not just going to be exactly the same thing that the previous year had, it's going to be much improved, right? And so over time, it just keeps getting better and better, even though the original, and sometimes maybe it gets better, but maybe not, right? Like maybe we try something else and that's even worse than the first version, right? So we're also going to get sort of a lot of an understanding about how you're learning and what's more effective over time, right? And we're carrying this forward as well as backward, right? So for this class right now, their next courses already, there's some changes that we're making in maybe how certain things are laid out or how certain things are thought because of the sort of data that we already have that's very specific to this particular class, right? And so it'd be the same for every year because you might have a cohort of students that have certain strengths and a different cohort that has other strengths. And so we're really able to do, I mean, it's really as close to an individualized curriculum as you could get, you know. And I know Dr. Manley's getting to the point where we're really able to show the students and say, hey, these are the areas in which you're weak and these are the areas in which, you know, you're doing well. And so students can then take that information and self-study and, you know, do self-directed learning, which basically then says, all right, well, now if I have to study and I have 3 hours that I want to spend studying, you can spend that time on the areas in which you're actually weak, as opposed to just sort of guessing where you are in the content, right?
And to continue on that a bit, so one thing I think that makes us unique here as well, as I've talked to other colleagues at other medical schools, is that our questions, for example, just like you might see in a commercial Q bank, we have QIDs associated with every question, and we have every question absolutely tracked and tagged. So we have them tagged according to system, according to discipline, according to the COMLEX blueprint, according to the USMLE content outline, according to competencies, according to things like that, down to the topic level of what our thing is. And so as a result, we really understand on a very granular nature what we're testing on. And so we're going to be using this metadata that are attached to these questions to provide visualizations to our students as well in the forms of graphs and like, you know, kind of radiographs, thing like, or they call kind of like spider graphs. So you could see like where your strengths and weaknesses may lay, and also you can see maybe where you are with respect to others in the class and stuff like that. And so by doing that, it allows us to give the students an awful lot of data, and it also provides us a lot of data as well, because as Dr. Akunyili was talking about, that to do like a CQI type of improvement of the videos, we can also do the same thing for the questions. So every test that's given, we've got kind of analytics of all these questions. We can dig in there and know exactly, like, okay, no one went for B, so that was a poor distractor. Let's see if we can get in there and have a better distractor for next year, or things like that. So every year, basically what we're doing is we're building our own Q bank that students will have access to, and that will simply improve as time goes on through this entire CQI process.
And I know we're geeking out a little bit, on all of this, Q bank and questions and things, because we're very excited about what this means for medical education and for your education. But I think maybe we pull it back to, how this curriculum really does support preparing you for your boards, but really preparing you for your first day as a physician, right? 4 years from now when you graduate. So the point of all of these, the questions, the pod plays, the assessments, is really to help you learn, right? They're really learning tools. And, Dr. Manley likes talking about, how we could make learning fun, and sort of take away the anxiety of test taking. Obviously, we can't take it quite to zero, but we could get you to the point that you start realizing, same way most physicians who, have to test all the time, because as a physician, testing never goes away, right? And assessments kind of never go away. You're going to have to take, your boards, and then you're going to get recertified, and you're going to be a lifelong learner as a physician if you, come into the medical field. And so really what changes is your relationship to assessments, right? And so what we're doing is trying to get that relationship sort of changed as early as possible, so you can embrace these more as sort of a way to get yourself to where you want to be. And, just getting a good sense of how you're doing, so that you could self-direct your own efforts and your own studies. And so it's very much so built into the curriculum to help you get to that point. And one of the things that I really like to use an analogy is that, look, if you ever watch a video of, like, say, Shaun White, nailing a 720 degree flip, right? He makes it look so easy, right? But no one ever showed you that before he got to that point, he fell a ton of times, right? And so that's really the same thing. We're really giving you the opportunity to, exercise, if you will, those brain cells, right? Like double click on the brain icon often enough that then you just sort of do it very naturally. And if you've seen the really great learners, and the people who make really great physicians are people who are very curious about asking questions, right? So when they're reading something, they're always asking themselves, oh, why is that? Or how does that happen? And so they're sort of doing it inherently. And what we're hoping is that we'll be able to create that culture within you, that you start asking the questions, so that at some point you'll start predicting almost what the questions are going to be. You'll be watching the video and having a good sense of, oh, wow, like, this is a question that I would have, or this is something that I'm curious about. And maybe you become curious or ask a question about something that doesn't really exist, or we don't yet know, medical science doesn't have the answer for yet. And then that becomes maybe one of the things you want to research. And of course, we also have a pretty robust sort of research piece to our education. And then that's kind of all goes hand in hand to sort of being that very well-rounded physician who, has to be, for all intents and purposes, have the capability to think like a scientist, right? Because, physicians, like, yes, we are treating patients at the bedside, but we are also, scientists as well. So that definitely comes into it. And the point of the curriculum is not to, like, dump you into the hottest water right off the bat. It's really to take you from the simple and the straightforward, and then keep building on that over time, right? So your first week of medical school, the questions, your curriculum, the material, it's going to be geared towards the fact that you are in your first week, and then we're going to progressively expect you to be able to do more and more and think through more and more difficult and complex things as you go on. So, board questions very typically have, double, triple jump questions, right? Very complex, integrating multiple organ systems, integrating multiple disciplines. Obviously, at Noorda, the way that the curriculum supports you is that we're not going to let you piece all of that together on your own. We're going to make sure that when you start on the first day and maybe you're doing the foundations of medicine, you're learning a simple concept, you're going to have a question that's at that level. But over time, that same concept is going to flip around in your second year when we're doing organ systems. And now it's going to be more complex because now it's going to be testing the same maybe biochemistry principle, but now it's in the context of pathology that you understand. Now it's in the context of pharmacology that you've already learned, right? And now we're putting it together in this organ system. And now we're able to ask you a very, very complex, very, very boards-like question. So we build up to that, right? And every step of the way, it's just going to get a little bit more complex, a little bit more complex. So by the time you get to those board style questions, you're like, I got this.
Well, and also to add even further, so two additional points, as what Dr. Akunyili was talking about, is that our goal is to decrease your anxiety. And let's face it, we want you to be curious creatures. We want you to be, absolutely, but we want you to pass the boards, and you want to pass the boards too, right? And so one thing that we're doing in these questions, and even early on, we are getting board style questions, is we're also mimicking the boards in terms of language, in terms of how they create their questions. And all of the questions that our students are getting right now are either written for kind of using USMLE language or COMLEX language, so that regardless of which test, or maybe you'll take both, you'll either take COMLEX or you'll take both, that you'll be already prepared. And so if you've already gone through hundreds to thousands of questions ahead of time, then by the time that and you'll be going to commercial Q banks as well, I'm absolutely sure, that by the time you actually sit for your boards, you don't even have to think about it. And you'll be able to recognize the language, the cadence, how they always do things in a fairly consistent manner and using a fairly consistent language. Another thing we will be doing to support our students as well is to have workshops on strategies, especially getting closer towards the exam. Like, what do you need to do to step through this question? What do you need to think about to step through each question to arrive at the answer, and not to kind of like trip and kind of like, oops, I'm just going to skip that and knee jerk to that, and then this question didn't work out so well. So we want to support you in that manner as well. So again, very boards focused in the sense that we personally would love to have 100% pass rate, and that is what we're shooting for. And so trying to provide this material, but as Dr. Akunyili was talking about, that in the beginning, questions can't be amazingly complex. So for example, a board style question for USMLE or for COMLEX can be, once upon a time, 20 years ago, they used to have things called single jump questions, where they're just asking a question like, what's the diagnosis, and things like that. Increasingly, they've added complexity to their questions. So sometimes we call it double jump. So it may be you have a patient with Parkinson's disease, and you ask, what's the diagnosis? That's a single jump question. Say you have a description of a patient with Parkinson's disease, you don't tell them that's the diagnosis, and you ask them what drug you're going to give this patient. That's a double jump question. Another question might be, if you have a patient with Parkinson's disease, you give them a drug, you want to know what the side effect of that drug is. That's kind of like a triple jump question. And so because we're building this Q bank within our school, it also allows all of the faculty to see what everybody's asking about, which I think is unique here as well, because in a lot of schools, they're siloed off into their own departments, and this department has no idea what this department is doing. So in this case, for example, if somebody is doing like a respiratory physiology question, maybe getting into a little respiratory pathophysiology, second year, when they're teaching respiratory pathology, they can go back into our Q bank and look at and see what has been tested and how can they build off that. how can they make it more complicated and also use the same information that you've already built, that you've already had as your building block. So that's another kind of method to our madness in a sense.
So I think one thing that we have to talk about is the big elephant in the room, because some people are going to wonder, well, that's all well and good. And of course, we're going to have 100% boards pass rate. I have no doubt about it. But, how important is all of this, since it's going to be pass fail for, level 1, step 1 anyway. And I know my thoughts on that, but I think I'm going to let Dr. Manley say hers, and then I'll circle back to me.
Well, I mean, so clearly things have changed now, right? Because USMLE and COMLEX, they're both. So I think first what comes to USMLE, January 26th, I think is when they're going to start going pass, no pass. And COMLEX, it's going to be May next year. It's going to go pass, no pass. So it's going to do a couple different things. Number one, it'll obviously decrease the anxiety of these tests, which is, I think, part of the rationale for them to make it pass, no pass to begin with. And so, whereas once upon a time, people would buy, 4 different Q banks to just crank on these scores in order to get into the best residencies. Now it's possible what'll happen now is that there's going to be more of an emphasis and more of a strain for your level 2 and step 2 exams, because those haven't gone pass, no pass yet. So we are definitely cognizant of the fact that it is pass, no pass. And as a result, we're also offering different types of things at our university to help our students distinguish themselves, because if everybody passes, how can you tell who the best students are? And that's where, for instance, our research program comes in, and other things like that. So hopefully that will decrease just blood pressures as we get to our level 1, step 1 dates. But still, we want to get past them for sure.
Yeah, so when we talk about, step 1 and level 1, so for those of you out there, pre-med students, you haven't yet been in the medical world. So when you get into medical school, you have to take an exam, and at a DO school, the COMLEX are the exams that you take to get to qualify to earn your DO degree. And at an allopathic medical school, it would be the USMLEs, which are the United States Medical Licensing Exams. At a DO school, you could take both. You have to take the COMLEX, but you could choose to also take the USMLEs as well. And then there's 2 of them. So the step 1 or level 1 is basically testing you on your preclinical, if you will, basic sciences. And then your level 2 or step 2 is going to be testing you on your clinical knowledge, which is typically taken in the 3rd or 4th year, typically 4th year actually, of medical school. And so the step 1 has now gone pass fail. And that has been done exactly for the reasons that Dr. Manley has outlined, to reduce the anxiety related with the competitiveness of medical students to try and get the highest possible score. Because obviously it's not the highest possible score that matters, it's what you know and how good a physician you will be. Having said that, right? Having said that, the boards themselves are questions that are about your understanding of the medicine that you need to treat patients, right? And so I think one way to think about this is, and especially even with the assessments that we have at Noorda and things like that, it's like right now, it's just a question, right? But 4 years from the day you matriculate into Noorda, you'll be a physician. And at that point, it won't be a question, it'll be a patient in front of you. It'll be a human being, right? Whose understanding of whatever they're presenting symptoms and disease and pathology are is very important for you to have. And so part of what we're doing is really to make sure that you are prepared when you walk into that hospital your first day as a physician, that you actually have the competency and the knowledge required to do the great job as a compassionate and competent and confident physician, right? And so the reality is like all of these assessments, and yes, we're going to make them as interesting as we can, as fun as we can, but they're relevant and they're important because they're really testing whether you understand fundamental concepts that are related to diseases that your patients will have, the treatment options, your understanding of the treatment options, right? So that you're not in a position where you are arguing that you will treat someone with anti-worm medication for a virus, right? Or you're not giving someone antibacterial medication for a virus, right? Because you understand the fundamental basic science that goes through to how those actually work, right? And so really the entire curriculum is designed to keep building on itself. So what I could actually tell you is that we've spun the curriculum backwards and forwards. So all of the pathology and cases we're expecting you to know and learn and see during your clinical rotations in the third and fourth year, we're taking those tendrils and pulling them back into your second year. So in your second year, when we're talking organ systems, we're going to talk those same pathologies. And we're pulling it down into the first year to say, what are the fundamental sciences that you have to know in order to understand those pathologies? And so in the first year, we might introduce you to, a patient that has diabetes. And right now we're teaching you the, metabolism of glucose, for example, glucose metabolism. So we might very specifically be talking about more the biochemistry of exactly how gluconeogenesis happens and exactly how glucose is broken down, but then that same patient, you're going to see them in the second year in the organ system disease, and now it's a little bit more elaborate, where now you're not just knowing exactly how glucose is broken down, but now you're talking a little bit more about the pathophysiology of the actual diabetes itself, and how it's impacting the body longer term. And you're also learning about the anti glycemic medications that you might be giving to try to control the symptoms of this diabetes, right? And so now you're learning that, and then you get to the third year where you're actually going to now have to learn it at an even more in-depth level, where you're learning management, not just from a theoretical, this is the pharmacology, but it's more from a, this is your actual patient with your actual patient presentations and histories. And now you're going to have to use all of that knowledge, your understanding of the disease, your understanding of the biochemistry, your understanding of the pharmacology, to then decide for this particular patient in this particular circumstances, which of these do we actually do? What do we actually do in reality for our patients, right? And so it's sort of the same strand is kind of getting pulled across the entire 4 years all the way across, which is why, I'm academic affairs, and we're mostly going to be very heavily focused in your first 2 years, but I'm also working with the clinical counterparts in the first and second year, right? Because you're going to have clinical components, you're going to have OMM, you're going to have a lot of things clinical in the first 2 years. And then the second 2 years where it's mostly clinical, then the clinical people fully take charge, but they're not living academic affairs out in the dust entirely. In fact, we're going to give you a lot more educational support in your clinical rotation years than most other medical students, medical schools do. And the reason for that is because we really believe that there is a continuity to this. And ultimately, even when you're done with medical school and you're in residency and you're taking step 3, which is what allows you to practice independently in the United States, when you're taking your step 3, you will have questions that test your understanding of how fundamental basic sciences are affecting the disease states that your patients are presenting with, right? And so it really all does matter. And if you think of assessments as something that's just improving your ability to understand and grapple with and think critically about the information that you're learning, then you just transform your experience and you learn so much more efficiently. Wow, so having said all of that, oh my, let's see if we have any questions from the audience. Kristen?
That was awesome. Thank you. All right, so we have one question coming in from Hunter on Facebook. He wants to know a little bit more about the resources and help available to students to help them or to get them to learn the material that they missed, say if they didn't pass an exam. And can you talk a little bit more about the opportunities to retake tests and what that looks like as well?
Absolutely. So students who do not pass a particular exam do have the opportunity to retake the exam. So they do have at least the opportunity to retake the exam and to receive a passing grade. So if it's the second time you take an exam and you get 100%, you don't necessarily get 100% because that may not be for the person who got 100% the first time, but you can absolutely get up to a passing grade on the exam. And that can also change, whether it be a midterm or whether it be a final. You do have the opportunity to retake the exam and then to alter your grade accordingly. So we do offer that ability.
And I could also tell you that for the daily quizzes, which represents 10% of your grade, right? Those, you could retake them right after they're done, and you could take them as many times as you need to until you get 100%, right? So we're kind of, and that's really what we have ended up having with this current class that we have right now, is just a culture in which students just like use those questions to learn. They try the questions, they go back, they do it again and again. And I mean, at this point, I don't think there's anyone who doesn't have 100% on those questions, right? So they really do get it. And my sort of point of pride is the fact that they now actually know that information, which is far more important to me than anything else.
And speaking of those daily questions, how many are they getting in a day or a week? What does that look like?
Roughly, so roughly it's 10 questions a day. And so the maximum amount of questions they'll have in terms of daily questions is, so basically we're set up in a 2-week cycle. And within our 2-week cycle, from Monday through Friday of the first week, they're daily questions. And Monday through Wednesday of the second week, they're daily questions. And then for Thursday and Friday, then you have the review sessions and you don't have questions on those days. And so the maximum amount of questions we'll have will be 10 questions a day for those 8 days. We don't necessarily have it every single day. There may be certain days that are a little heavier with lab or something like that. And so it doesn't really kind of lend itself to questions that day. But so at the most, it would be 80 per 2-week cycle. That's how it is right now.
Great, thank you. All right. So this is coming in from Kiana on Zoom here. Do you recommend students take both the USMLE on top of the COMLEX or just focus on one? And then also, are students ranked at Noorda-COM based on their COMLEX scores?
So I could tell you that that was going to be a discussion with the learning specialist and the students, docents, and academic affairs as to which is better for every student. There are going to be students where I'm absolutely going to say, yes, please, go and take both exams. Absolutely, you should do this. And there are students who might be saying, you know what, I have to focus on one or the other. Which one do I focus on? If you are at a DO school, you absolutely have to focus on your COMLEX, because you absolutely have to pass your COMLEX or you're not going to graduate, right? And so COMLEX is sort of what you have to focus on doing very well. Now, if you could focus on COMLEX and you feel you still have the power to do more and push yourself more, then you could sort of look at doing the USMLE. On average, across the country, at most DO schools, about 60% of the students take both. I predict that it will probably be a higher percentage at our school that will be able to take both, simply because we're having so much assessment tied into their prep, and we're making sure that we're covering not just the sort of material that's on the COMLEX, but also some of the questions that are more sort of USMLE style content, right? So we're making sure that we're covering all the content that would have been covered at an allopathic medical school, as well as making sure that, you still have that COMLEX philosophy and focus kind of threaded through all of it. So for any student that would want to take both of them, I think they will be in a very, very good position to be able to take that. And to that end, one of the things I really wanted to point out, because now we have, students in our classes, I could tell you that, we just finished midterms for our Foundation of Medicine content. And I'm not going to tell you the actual class average, because there's no need for that. But what I will tell you is that our class averages are impressing me. Like, I am so impressed. Just with how well our students are doing. It is out of this world. It is 15, 20 points higher than the sort of performance that I had seen in my career previously at medical schools. And I would put like the lowest scoring students in our class, I would put them up against the top students in most medical schools. That is just how good our students are doing with understanding and mastering the material.
Awesome, thank you. So kind of along the lines of like midterms and final exams, how many are there? How often are they? And are they cumulative or not? Can you speak to that a little bit?
Well, right now, each class has a midterm and a final. And you can see from our website, for example, like how our classes are structured when classes start. They are cumulative. Like, so in the final, we don't want you to, I remember one time when I was at a previous university and someone literally asked me when they were studying for the final, can I just forget what I learned before the midterm? And I'm like, oh, no. And so I think it's good to have it cumulative so that you don't just like cut it off and just kind of chuck that stuff away. And so so is it 50-50 when you get to the final? No, it's probably maybe 20 to 30% is from previous material, but I think it's a good thing that it is in fact cumulative. And so, but every class right now has like one midterm and one final.
And actually, one of the things I want to speak to about that too is part of the reason why there's this whole mindset of, oh, I'm done with that, let me chuck it off and like focus on something else, is also this idea that, that material is done and it's over with. But you're a physician, it's never really over with, right? You kind of have to know that stuff. But the nice thing is because we're doing these daily quizzes, Dr. Manley has an opportunity to take at least a concept, right? Something that's a very good question, or maybe even a concept where the student struggled the first time, and then, have that question and drop it in the future. And then we'll see, okay, did they really get it? Do they still remember it? Did they learn it well enough that it is now a part of their understanding of medical science and not just something that they memorized for, a couple of hours before the exam and got it right? But you don't actually really know that concept, right? And so the curriculum is designed in such a way that we're really trying to help you learn and trying to help you be better physicians. It's not just about like testing for testing's sake or, going through the motions. It's really, and I think part of the reason we can afford to do this is because we don't have content that isn't relevant to you being a physician. Because I think one of the things we've done a very good job of, and I'm sure we could do a better job, and we're going to try to keep doing better job at it, is cutting out content that's not actually relevant, right? And so we have what we call the core curriculum. And the core curriculum is really everything we know that you need to be a successful physician. And faculty can create content that they're passionate about if they want to. We'll just put it in advanced content, right? But we're not going to burden students with information that's too esoteric and, just, because you have, you could, every single thing in medical school, there's someone who wrote a 600-page dissertation on it. Okay. And we're not bringing those 600-page dissertations into the class or into the conversation with students. And so that way we're really focused on, well, this is specifically what you need. There is all this other material out there. It's going to be an advanced content. And what that allows us to do is if there is core content that students are struggling with, it then means that maybe for the next year, we then have to think about, is there foundational content that we should provide to students that maybe don't have as strong a background in this particular type of subject so that they're not struggling with the core content as much, right? And so I think every subsequent year, as we're having that data, we'll have a little bit more of that. So for this year, we had a pre-matriculation course in anatomy and physiology because we knew the students would need that to come in and be able to do their, osteopathic manipulative medicine from day one. And so we have that ready, but now with the sort of data that we're able to get from Dr. Manley, we could go back and say, well, maybe there's a couple of other topics we might have wanted to have students a little bit more prepared when they got into medical school, right? And so we'll be able to sort of add that on as well. So there's definitely that process of let's make sure that we can help you be successful, right? Like our mission is to help you become the best physician that you can when you graduate from here in 4 years, less so just board scores or anything like that.
And the other thing, one other comment about the daily quizzes is that, a friend of mine who taught anatomy at a different medical school was just shocked at some failing students in anatomy, and he's just like, how did I not catch this? How did I not know what happened? Like, so one nice thing with these daily quizzes, we have kind of like our finger on your pulse in a sense. So we can find out ahead of time, before you take a midterm, before you take a final, like where there may be potential problems. And then the other thing we can do is, because of the data coming in the daily quizzes, and we could say, okay, so they had a problem with this concept. Then the professors will talk about that in their review sessions. Then we could take that question, spin it, put it back on your midterm and final, and see, like, do you understand it better now? And so it kind of gives you kind of another opportunity to have like information reinforced and have another go at it.
Awesome. Thank you. That's one thing that I love about Noorda-COM is we're really putting our money where our mouth is when it comes to being student-centered and doing what's best for the students, and not just saying, well, this is how we wrote the curriculum, this is how the questions were written, like deal with it, too bad. Instead, we're constantly learning and changing and doing better. And that's one thing that makes me really proud of us here at Noorda-COM. So thank you for sharing that. All right, next question. So are the COMLEX and USMLE structured in the same way as far as the style of questions and the testing structure, or how does board prep look similar and maybe different for the two exams?
They are largely the same. They have a lot of similarities, and they have some specific differences. So they are both single best answer multiple choice questions. So and used to be, at least I can speak for USMLE, they used to have a lot of different type of questions. They used to have K-type. They used to have a lot of different types of questions. Both organizations have now pared it down to one question type for level 1 and step 1. And that is just like, here's a question and there's one answer for this multiple choice question. Tends to have a minimum of like 5 options, can be 4 options. It can be, especially when you get to drugs and bugs and stuff like that, it could get up to more options than that. So in that sense, they're very similar. They approach it a little bit differently. Their language, it's kind of funny. Their language is very consistent among each other. So for instance, like a USMLE, it'll always be a 40-year-old man, comes to the position because da-da-da. And the COMLEX will always say a 40-year-old male presents to the office because of blah, blah, the complaints. They always have very, very similar language between the two of them, but essentially it's fairly similar. So one big difference with COMLEX is that number one, you have osteopathic questions. That obviously is not on, USMLE. And the other thing that COMLEX can do is they can, even if the question is not asking something specifically about an osteopathic concept, they can put that into their stem, so and into their vignette of the question. So maybe it's a question about someone who has appendicitis, but they may also say, well, like osteopathic structural exam reveals blah, blah. And it will help you kind of maybe arrive at that diagnosis. It won't necessarily hang you on that diagnosis. So even questions that aren't specifically asking about that may have some of that type of information. There's other just like superficial differences, like USMLE, they will provide you with, like a PDF type of thing of all the lab values in the question. COMLEX is like, we don't want to waste their time by having them go look up these lab values. We're going to put the lab values in the reference ranges within the question. And so they approach things slightly differently, and we're providing questions in both styles so that you're just really familiar with both of them. But at the end of the day, they're both single best answer multiple choice questions.
Yeah, and I think from an academic perspective, what I could tell you is that there is a little bit of a difference in the content that is tested.
Yeah.
So for example, you're going to have a lot more sort of biochemistry, pharmacology heavy questions on the USMLEs than you typically would on COMLEX. And COMLEX will focus a little bit more on inherent ability, immunology, micro, than it would, than maybe USMLE would. So there's slight slight differences in the sort of content. And I think that's where we as a medical school are unique, because even though we're a DO school, and even though, our focus is osteopathic, we're looking at everything through the osteopathic lens, but we're actually giving you the same level of biochemistry and all these like what you would call pre-med sciences as you would get at an allopathic medical school. And that is precisely because in reality, you do have to have an understanding of these at the same level as your allopathic counterparts as well, right? And that's partly why I'm very convinced that our students would have an easy time taking either the COMLEX or the USMLE, because for a fact, we teach everything that's required by USMLE within our curriculum. We meet all of the COMLEX blueprint criteria, but we definitely also have made sure that we're teaching everything that's in the USMLE blueprints as well.
Awesome, thank you. Another question with regard to the 2 and 3 digit scores that we've heard about in other sessions. Can you guys speak to those a little bit more about kind of what are those, what do they mean? And furthermore, how does that help students know how they're ranking compared to their peers and maybe predictive for board scores and that sort of thing?
Yeah, well, I mean, I'll let Dr. Manley speak more about this in a second. I just want to say an overarching thing, and that's like the goal of that is really for us to have a system that translates all of these tests that you're doing and all of your midterms and final scores and daily quizzes into, based on this knowledge, based on the questions you're currently able to answer at this point in time. If you were to take your board exams, this is sort of what we think this will equivalent to. Okay. And keep in mind that when we're doing this, we're making an educated guesstimate about this. And I call it an educated guesstimate because we have someone like Dr. Manley figuring out how she's going to put that piece together, with 25 years of experience doing test prep behind her, right? But at the same time, you also have to keep in mind that, especially because we won't actually have scores, USMLE or COMLEX scores for step 1 from students back, we won't necessarily ever be able to validate it in the way that we would have wanted to, right? But again, a lot of experience going into thinking about how we're setting that up so that it really is meaningful to you, but also to program directors to have a sense of, if the student were taking a 2 or 3 digit score exam, where would that performance in their medical school curriculum place them on that scale, if that's sort of helpful for students to understand. And I'll leave it to Dr. Manley to talk maybe a little bit about the process of how she's putting this together.
Yeah, I mean, so clearly we have just normal grades and things like that, but we trying to kind of again correlate the grades with the 3-digit number. So USMLE just has 1 score. It goes to 300 or so, and well, it does. and COMLEX goes, they don't actually quite say, but it's probably about to 800 right now. We know where the passing scores for both exams are, and so we're trying to make kind of a prediction of what would your USMLE or 3-digit COMLEX score would be, and then the 2-digit COMLEX score is kind of basically the percentile. And so part of the goal in that was coming from our dean, who wants to provide this information to residency program directors, so that they have a sense of like, this is how they would do. Now, again, for someone who likes to crunch data and things like that, it would have been sweet if we had, these scores that we can come back and validate and really make strong models. So it is in fact a guesstimate that this is approximately how we think you're going to be doing. But again, and also to inform others that, these are where your strengths and weaknesses are. So that's kind of the idea behind the 3 and 2-digit scores.
And I mean, ultimately, eventually we will be able to validate it, because first COMLEX 2
level, right?
Will have, right? So like, hopefully our model, and we'll have enough data, and then if the model validates it by the time you're taking the exam, if that comes through, then that will eventually validate the model. But again, that's like modeling what you're doing. But it's also a good sense, because part of the reason why students are so anxious with board exams is that they've been studying so hard, and then you're taking exams where like everyone is doing universally well, right? Because at a lot of schools, and then they curve it, and so everyone's getting all these high scores, and you don't really have a sense of, yeah, but how am I really doing? So then when it's time for boards and you start taking, maybe your first commercial Q banks, you're doing blocks of questions, you're realizing, oh wow, like, I mean, I did great on this course and I ranked the professor very high, but guess what? I didn't actually know anything. I knew a few superficial things, but I didn't actually understand the material enough, right? And so now when you're giving me complex questions where I have to integrate multiple subjects to answer one single question, I'm struggling, right? And so the students get to that point and they start struggling. They're realizing, wow, I never realized that I was struggling. Now, obviously, medical students are typically very bright and very driven, and so they're able to overcome it and study and still do well on their boards. But what we're trying to do is, well, we're going to tell you if you're struggling a little bit earlier. Okay, maybe not in the first semester because we don't have enough data for that, but by the time you're getting through first semester and you're starting to get into second semester, at that point we have enough data on questions you've been answering to give you a good sense of, well, this is where you are in reality. So
Great, thank you. All right, one other question I have here. Are there study skills that pre-meds could practice to be ready for, or maybe classes that could be taken, that sort of thing, that prospective students who are currently pre-meds to be ready for our curriculum and the way that we're doing things here at Noorda-COM?
Not necessarily particularly. I would say that if you had, undergrad level anatomy, physiology classes would be definitely helpful. It's one of our, prerequisites. That's not really a prerequisite, because if you don't have it and you're a good student, we will provide that for you in the summer before you start school with us. But if you do anatomy, physiology classes, that's very helpful. Any biochemistry, definitely very helpful to have. I know a lot of our students who have a background, either a master's in biochemistry, they've just had an easier time with some of the concepts that other students struggle with. So that's definitely a plus. But it's not one of those things that I would say you should go out and do, necessarily to be able to get into medical school. Like it's not a requirement, because if you are weak in those areas, we're designed to be able to support you to become better at them and well enough to do well in school. So, I wouldn't say, go out now and like, you were a music major and you want to be a doctor and like, now you have to go take biochemistry classes. Like, we'll get you there at Noorda. Like we're designed to be able to get you to where you need to be.
In fact, I might almost advise you to take it easy a little bit while you can, have a breath, take some deep breaths while you have the ability, and you'll be able to take deep breaths in medical school also, but don't burn yourself out before you even get here, so do what you need to do to get into med school and stuff like that, and then you just kind of relax, and then just get a lot of sleep and stuff like that, and start fresh, and that's what I would actually suggest.
Yeah. Pacing and wellness,
Yes.
And wellness,
Yeah.
Because sometimes you take on so much that you don't do any of it well, which isn't helpful either. So, it's actually better to know fewer things, but to know those things very well, because you could use anything you can use to think through a problem in front of you. But if you just know a whole bunch of stuff superficially, then none of that is really helpful to you, because then you don't actually have the tools to address any new situation that comes up in front of you, right? And so I would just say, like, if you do take an anatomy class in undergrad, just learn the anatomy well, and then, okay, you don't know the biochemistry, but you know the anatomy well. And so guess what, it'll compensate and it'll work out. And, instead of trying to take like 5 very difficult classes all at once, or, trying to do the baccalaureate program that you're trying to learn all this stuff and then just struggling through that as well.
All great advice. Thank you. All right. And we are about out of time. Do you guys have any parting words or bits of wisdom that we can leave with our attendees, our viewers today?
Embrace questions. Getting questions wrong is the best way to learn. And so instead of being anxious, even right now, some of you might be prepping for your MCAT and you're dreading trying to do a a test, a dry run, right? Don't do those questions. Get the question wrong, because I bet you every single question you get wrong while you're studying is a question you will not get wrong on your MCAT, right? And it's really the same philosophy. If you just embrace questions and asking questions of yourself, you're going to learn so much more, so much faster, so much better.
Yeah, consider an incorrectly answered question as an opportunity to learn. Instead of considering it as a failure, and just consider it as, I'm glad someone pointed this out to me. I'm going to have to dig into this a little bit and consider it as an opportunity.
I love that. Thank you. Thank you. Thank you. And thank you both for being here with us today and sharing this very exciting stuff about how we're doing things differently with regard to testing and assessment, like everything that we're doing here at Noorda-COM differently. So I appreciate that. I think that this has been really helpful to shed some light on some of the things that we've kind of talked about at the surface, but really diving in and getting a better understanding, I think, is really helpful for all of us. So thank you. And then for those of you who are joining us, thank you for being here with us today. And we invite you to be back with us next week. We will have Dr. Danto talking about osteopathic principles and practices. And as always, you can find the registration links for that session, as well as all of our upcoming sessions, on our events page, which is noorda.com.org/events. And then if you missed any of our previous Faculty Friday events, you can find recordings on our YouTube channel, as well as our Facebook page. And then on the events page, there are links to the YouTube recordings as well. So thank you again for being with us here today, and we'll see y'all back here next week.
Thank you very much.
Thank you.